The laser that is to reshape David's eye is in a clinic just outside Chester. If it fails to correct his bad eyesight, his life will be devastated. He stands to lose his job, be in debt to the bank, and maybe he'll even have to sell his home.
Hello.
Hello.
Hello. David Drain.
From recruitment?
Yes.
Yes, so we'd just like to take a seat in the waiting room and I'll be with you shortly.
Lovely. Thank you very much.
Thank you. Okay, Mr. Drain, are you ready? Would you like to follow me?
Fine.
Okay, Mr. Drain, I'm just going to put a series of drops in over the next 20 minutes.
Yep, okay.
There's 4 lots. Can we just check it's your right eye?
Yes.
Okay, if you could tip your head right back for me. You might find it runs into your throat a bit. Okay, they do tend to sting a little.
If you like to have a seat on the yellow chair, the nurse will put the pads on your eye and I'll get ready to start the procedure. Move the chair under the laser. Can you push the chair around for me, please? Thank you. That's fine. Just go down a bit more. Just getting you lined up for this. Keep your head back slightly. Try and relax as much as you can because I need to make some fine movements of your head. Now, can you see a fixation light in the center of the tube?
Yes.
And do you see a red ring around that light?
Yeah.
That's fine. You're nicely lined up. Now, you start by putting a clamp into your eye. Try not to squeeze. Do you feel that?
I feel that.
Just put a drop into your eyes. Just another couple of drops won't do you any harm. Do they sting? I think you feel them wet, but they shouldn't sting. Try not to squeeze. Do they sting at all, or do they just feel wet?
No, no stinging.
There's no stinging. Well, that means that you're anesthetized, so don't worry about it feeling wet. Try not to squeeze your eyes, because it's a lot easier if you don't.
I think it's just getting used to the clamp being in there.
I think the thing to do is to just try and forget about it being there.
I'm not sure whether I'm actually blinking or the light's
No,
flashing.
well, you can't blink with the clamp in place, so don't worry about it. Chin down a bit, you're a bit tight. Right, now that's correctly lined up. And this is the demonstration run coming now. Ready? That's it. Just try and relax, you're doing fine. See, the laser doesn't penetrate water at all, so it's got to be completely dry, otherwise you don't have any effective treatment.
It's almost like a tickling sensation.
That's right, yes. Well, as long as it's tickling and not stabbing, you're all right. I'm going to start the marking now. Now just stay there. Just the marker going on now. Good. Excellent. Now I'm going to take the surface layer of the eye.
This is the hockey stick, is it?
This is the hockey stick, that's right. Well, I should tell you, it's a blunted hockey stick.
Oh, I thought it.
It's quite interesting. You wonder why they make a sharp instrument, and then before you start off, you make it blunt. You make sure it's blunt.
Yeah.
But this just takes the surface layer of cells off, and the reason you blunt it is because you don't want it to be damaging the next layer down.
I can feel it tickling in the corners. But because the drops are actually affected what I can see anyway, I mean, it's I can just see a mass of lights, and I can actually see lots of like floaty bits, if you like, for want of a better word.
Yeah, that's all the debris that's coming off from the front of your eye. I need to clean this completely, because even if I leave one cell behind, it has a significant effect on the outcome. Perfect.
Laser is set for 1.9 diopters at 5mm zone.
If you'd like to fix onto the fixation light again, can you see it?
Yeah.
Chin down a fraction. Are you ready on the fixation? Okay, starting now. Good. That's done. Fine. We'll move you aside now.
Did I do well?
Yes, you're fine. You were still and you did what you're supposed to do. We'll take you off and I'll look at you on the slit lamp. If you'd like to walk him down to the slit lamp for me, please.
Everything's very hazy.
Yes, it will do because...
Okay.
Okay. Now, if you'd like to come over here, give me your hand. Have a seat on here. There's a chair behind you. Good. If you'd like to turn round and face me now.
Swivel chair.
Okay. Come forwards, put your chin on here. Beautiful. You can just about see the rings of the laser. Absolutely central. It's a nice treated area. Good. And okay, close your eyes now. Thank you. I'll give you those. I'll give you that. Now, I think we'll take some of these pads off. I'm sorry, that hurts more than the laser, doesn't it?
That's right, yeah, that's the most painful bit.
Oh, well.
Hello?
Right.
Can you see?
Can you see?
Out one eye, I can.
Try that.
Very, very hazy.
Yeah,
But,
it will be because there is no layer of epithelium on there. Now, we'll put some more drops in. Let's, these are the anti-inflammatory drops, the ones I said would reduce the pain. Look up. Okay. Put a pad on your eye. Close your eyes now, please. There we are. Quite a lot of tape there.
She's not doing my cred rating a lot of it.
That's it. That's all done.
That's fine. Thank you very
Good.
much.
You're welcome.
Hi.
Yeah.
Okay.
Yeah.
Hurt?
No, not at all. No.
Sit down.
Bit disconcerting. Yeah. Bit disconcerting, but
Brilliant.
no.
Brave.
Yeah. Not brave.
Not brave.
No, not at all. No. I just feel a bit of an idiot wearing this.
Oh, you don't look it.
No, no.
You all right?
Mm. Yeah.
Okay.
No
everything
pain.
went-
No.
Everything went smoothly?
Oh yeah.